So this is Mental Health Matters, and we are, as you should know, the first Friday of every month at 11:30, we have a new topic and conversation. This month, we are talking about ADHD, challenges and superpowers. I wanted to let you know that we are SC Thrive. If you are new and you're not familiar with us, we're a nonprofit organization that leads South Carolinians to stability by providing innovative and efficient access to quality of life resources. And we consider mental health education to be one of those quality of life resources. Today, we will be talking with April Watson, who is a nurse practitioner, a board certified nurse practitioner, and she is with Greenville ADHD Specialists in Malden, South Carolina. Welcome, April. We are glad to have you with us. Can you tell us a little bit about yourself and what you do?
Sure. I'm a family nurse practitioner. Of course, as you said, I practice in Malden, South Carolina. So our practice specializes in the diagnosis and treatment of ADHD and other conditions that are also associated with ADHD. So we evaluate those that are age 3 and above. My background as a nurse practitioner is in internal medicine and primary care, but now I devote my entire practice to that of ADHD. So I appreciate you having me today to discuss such an important topic.
Awesome. We are glad to have you. So ADHD is a common acronym that we hear, and most of us know that it stands for Attention Deficit Hyperactivity Disorder. But many people only think about the H, or the hyperactivity part of the name. And for many years, people incorrectly stereotyped ADHD, and it was only seen as wild or hyper children, or they may not even known that ADHD was a thing. I remember when I was in elementary school, we had some boys in the class that the teacher would take a belt and she would kind of seat belt them into their chair so they wouldn't get up and walk around the room. Or, she had 2 girls in the class who would help the boy clean his desk every week to keep it, tidy and organized, at least on a weekly basis. But I don't remember at the time, when those things were going on, that people really even knew what ADHD was. Even in the medical community, ADHD was incorrectly categorized by professionals for years as a disruptive behavior disorder. In 2013, ADHD was incorrectly recategorized as a neurodevelopmental disorder, meaning that it actually impacts your central nervous system and your brain development. And while changes in environment can influence the way symptoms show up, the disorder is driven by biological and chemical impairments. It can have an impact on emotions, behaviors, and the ability to learn new things. Now, in our time in this century, it is commonly accepted that ADHD persists into adulthood for many individuals. Overall, between children and adults, more than 14 million people in the United States have been diagnosed with ADHD. However, the number of people who are actually living with ADHD is greater than the number of people receiving treatments for it. Well, males are at least 3 times more likely to experience ADHD than females. It can occur in all ages, races, and socioeconomic groups. So, Nurse April, a lot of people may also be familiar with the term ADD, and that was common for a while. What is the difference between ADHD and ADD?
So ADD is actually an outdated medical term that was meant to describe someone who isn't hyperactive, but may have trouble with impulse control or attention. So now the ADHD is the correct term that we use. And actually it's now broken down into 3 what we call subtypes. So those subtypes are the hyperactive and or impulsive type, the inattentive type, or the combined type, which combines the previous 2. And really the subtypes are only really needed for insurance purposes or medical documentation. So now the correct term that we use for everyone, whether they're hyperactive or not, is ADHD.
Awesome. That's good to know. We always, when we're talking about mental health conditions, like to use the correct terminology and the correct language, because as we say in mental health first aid, language is very important.
Right.
So comorbidities are two or more distinct diagnoses that exist simultaneously and do not go away once the primary condition is treated. Comorbidities are common in many mental health conditions, and roughly half or 50% of all people with ADHD also have a second condition. It could be learning disabilities, depression, anxiety that requires separate treatment. What are the most common comorbidities that you see at your practice?
Actually, anxiety and depression are probably what we see the most of. But what's actually interesting about those is those can also be symptoms of untreated ADHD as well. So sometimes we find that if we treat the ADHD, that the anxiety or depression may also improve to a certain degree. But in general, anxiety and depression would be the most common that we see.
Awesome. And do having comorbidities make it easier or more difficult to diagnose ADHD?
Well, I wouldn't necessarily say that it makes it easier or more difficult, but it's important just to sort of take into consideration the big picture and the whole person, and what's going on and what they're experiencing, to consider all of the potential diagnoses and then sort of rule things out from there.
Awesome. And I know that ADHD we talked about, can exist in any age. Do the comorbidities differ between children and adults that you see?
Um, well, actually, in children, we most commonly see what's called oppositional defiant disorder. That's something we see more in children than adults, as well as in children. Learning and writing disabilities are fairly common, but just as with adults and children, anxiety and depression can occur quite frequently as well.
That's good to know. So ADHD is definitely not a one size fits all disorder. It looks different for everyone and it can vary from person to person. There are a broad range of symptoms in two categories, like April had said, the inattention and the hyperactivity impulsivity. Adults may experience ADHD symptoms very differently than children and adolescents, and the symptoms that a person experiences can change over time and present themselves differently at different ages and different developmental stages. In considering the symptoms while diagnosing people with ADHD, they should show a persistent pattern of inattention or hyperactivity, impulsivity that interferes with functioning or development. We may all from time to time, have some inattention or hyperactivity, but it's that consistent pattern that really speaks to us with ADHD. Several symptoms are present in two or more settings, such as at home or school or work, with friends or relatives or other settings, other activities. There's clear evidence that the symptoms interfere with or reduce the quality of social, school, or work functioning. So as we like to say in mental health first aid, it interferes with your ability to live, laugh, learn, and love. And the symptoms cannot be explained by another mental health condition. What are some of the most common symptoms that you see as a nurse practitioner with your patients with ADHD?
Well, the most common would be just what you had referred to earlier with the inattention and the hyperactivity or fidgeting in adults, maybe trouble controlling impulses, being easily distracted. Those are very common, but also difficulty regulating emotions. So that can be in children or adults. That's actually a very common finding with those with ADHD, as well as difficulties with our executive functioning. So that would be some executive functions that we have: organization, working memory, prioritizing, planning, initiation of tasks. Those deficits in executive function are also very common.
That's good. And we'll talk a little bit more about those things later. Um, so what are the approaches that you all take at Greenville ADHD Specialist in diagnosing an individual who thinks they may have ADHD? How do you determine it?
So we have a little, so the process for determining or evaluating a child versus an adult is slightly different, but they do have a lot of similarities. Our patients do what we call rating scales for us. So if it's a child, their parents would answer questions. Rating scales are like questionnaires about their symptoms. And then for children, we would also ask for teacher input as well. For the adults, they would do the rating scales or questionnaires about their own symptoms. And then we also do what's called the QB test. And the QB test it's an FDA approved test to help us diagnose ADHD. So it is a computer-based performance test that looks at hyperactivity, attention, and impulse control. So people that are age 6 to 12, they take this QB test, and it is a 15-minute test. And then 12 and up take a different type of the QB test that lasts for 20 minutes. So in other words, then after we get that information from the testing, we do a clinical interview or take the history of the patient, whether it be the parent, the child, or at the same time, or just the adult, and in our office. And so once we get all of that data, we sort of put it together to see, okay, are we making an accurate diagnosis of ADHD? Or if we're not making a diagnosis of ADHD, is that the most accurate based on the information that we've gathered through those testing?
Awesome. And I saw you also do some genetic testing I saw on your website too. Is that something you do frequently, or is that?
So that is so it is available for anyone to do that genetic testing. But what the genetic testing does is sometimes if we're having trouble finding a good treatment, or if we have a patient come to us who've been treated elsewhere and they haven't really found a treatment that works best for them, sometimes we do utilize the genetic testing. And what that's going to tell us, it gives us kind of information on our DNA and our genetic makeup that is never going to change about a person. And it tells us kind of what does our DNA say about what would be a likely response to a certain type of medication, or are there any factors that we need to consider when we are trying to choose a treatment? Not only does it tell us a little bit about that, but it also tells us, how fast or slow we metabolize certain medications. And these are medications that we would use to treat ADHD or anxiety, depression. So it's a very specific panel that we do in terms of that genetic testing. But that is definitely an option. It's not something that we sort of automatically do, though.
Gotcha. So your QB test is your go-to first testing.
That is correct, Barbara. So the rating scales, the QB testing, and the clinical interview or the history are the core components.
Awesome. That is good to know. So as you mentioned earlier, the 3 types of ADHD, they commonly group together and manifest themselves in 3 different ways. And it was good to know that you said that, these are only used basically for insurance purposes or diagnostic purposes, but the hyperactivity impulsive is usually marked by symptoms like fidgeting, running, talking too much. And although this is the most stereotypical and commonly thought of type when we hear ADHD, it's usually the least commonly diagnosed type. Inattentive ADHD is characterized by a lack of attention to details, inability to follow through, remember instructions, getting distracted easily. And the combined type is a combination of traits that have both the hyperactive impulsive and the inattentive types of ADHD. And just as signs and symptoms may change throughout one's lifespan, their type of ADHD may change as well. So is it more common for different demographics to exhibit different types of ADHD, or are they all pretty universally represented?
Well, I would say that males do have a higher rate of diagnosis of ADHD versus females. Females are actually about half as likely to be diagnosed with ADHD in general. And so the male to female difference in diagnosing could be because a lot of times males tend to have the more external symptoms of ADHD, which could be the hyperactive or more sort of rambunctious or more impulsive. So they're usually easier identified, in other words. So there would be that difference in terms of what is diagnosed most. A lot of females may present with more of an inattentive type, and they're not necessarily a behavioral concern. They're typically very quiet and keep to themselves, and so sometimes that sort of flies under the radar a little bit.
Gotcha. And does age have any effect on the type, or is it pretty universally accepted across ages, all of the types?
Yes, I would say definitely in general. I mean, it's there's children. If we're talking about children versus adults, children are going to be more diagnosed than adults, and there's some thought that adults can't be diagnosed with ADHD. Um, that is not true. And so ADHD, the majority of ADHD is genetic. So it occurred in childhood, but it may not be picked up on until later in life or, in adulthood. So, children, those under 18 are more commonly diagnosed.
Definitely. I know my husband, he didn't really understand that he had ADHD until he was in his 30s. Because like I said, when we were children, it wasn't really thought about that much. But as he did research and learned more and more about it, like he was just like epiphany, like, oh my goodness, it's all making sense now. Everything that's happened in my past and everything I'm going through. It was just great to have that diagnosis as an adult.
Yeah.
So you talked earlier, you alluded to executive functioning. Executive functioning
Mhm.
refers to the cognitive and mental abilities that help people engage in goal-directed action. They direct actions, control behaviors, and motivate us to achieve our goals and prepare for future events. People with executive dysfunction struggle to organize and regulate their behavior in ways that will help them accomplish long-term goals. A lot of times they're focused a lot on short-term goals. When a person has weak executive functioning in certain areas, he or she may have trouble analyzing, scheduling, completing tasks, planning, organizing things. Um, People with executive dysfunction and ADHD commonly lack the ability to handle frustration, recall and follow multi-step directions, stay on track, self-monitor, self-regulate, and balance different tasks like a child balancing sports versus academic demands. The back of the brain is where you store information that is already learned. And the front part of the brain is where you use this information to be socially effective and succeed in life. Excuse me. This prefrontal cortex mediates the executive functioning, and it contains four major circuits. So the what, which controls your working memory and helps you to execute those plans and goals and specific steps you need to complete a project. The when, the circuit that helps you organize the order in which you complete the activities to address timelines. The why circuit controls your emotions and what you think about and how you feel about it. And the fourth house circuit controls our self-awareness and our feelings and our experiences. People with executive functioning challenges and ADHD may experience impairment in one or more of these circuits, and therefore their symptoms can touch their memory, their planning, their emotional regulation, and or their social skills, their ability, to have a friendship or a partnership with an individual. How can a parent for a child or a partner for an adult or the individual themselves recognize their executive dysfunction as a symptom of ADHD versus the normal distraction of a busy day-to-day life that we all experience to some extent?
Hmm. Yeah, that's a great question. Executive dysfunction is going to have an impact on our everyday life consistently. So these are things like um, can be things that we would consider simple things like, what are we going to have for dinner tonight? Trying to decide or plan on that. always forgetting where you put your keys. And so, not just in periods of increased stress or when a lot in life is going on, but every day I misplace something, or I just have trouble starting on something, whether it's the laundry or putting away things around the house. So in order to kind of make that distinction, it would be a consistent pattern of trouble with those executive functions.
That's good. Um, Thank you for that, because I know all of it. I lose my keys from time to time as well, and it's one of those things. How is it ADHD or is it not? Um, what are some of those strategies that an individual with ADHD can use to improve their executive functioning?
So managing the ADHD, so medication management with stimulant medication, that's the gold standard of treating ADHD, and that's for anyone 6 years old and above. However, people may incorporate coping strategies or coping skills to help with certain deficits in the executive functions, and that could be things like making lists, establishing a daily routine, using planners or organizers, setting timers or alarms. Those things can definitely be helpful, in conjunction with treating the ADHD as well.
That's good. I think there's some apps and things as well that are out there.
Mm-hmm. Like planner and task organizers, and mhm. And timers are a big thing because um, time management is a big part of executive function too. And so people with ADHD sometimes have something called time blindness, where you may think that 15 minutes have passed, but it's been 2 hours. And so so that's a real thing. And so utilizing, you're right, there's different apps and there's all sorts of technology now that can help us kind of, set boundaries and to help us improve or to manage those executive function deficits.
Right. And that 15 minutes and 2 hours, I know I experienced that with my husband. And people think of that distracted ability to concentrate, but they also have that hyper focus where they can, lose
Mhm.
track of time because they're so hyper focused on something.
Right.
So another thing you had mentioned earlier is that rejection sensitive dysphoria, or it's commonly referred to as RSD, it's an extreme emotional sensitivity and pain, sometimes even physical pain, triggered by the perception that a person has disappointed, been rejected, or criticized by important people in their life. And because of that disappointment that they created, those people have withdrawn their love, approval, or respect. And this is not necessarily based in reality. It's just based in the perception of the individual. The same painful reaction can occur when you fail or fall short of your rather high goals or expectations. RSD commonly occurs with ADHD, as you said, and it causes that extreme emotional pain that plagues both children and adults, even when no actual rejection has taken place. It may also be triggered by a sense of falling short, failing to meet their own high standards or other expectations. These feelings can be debilitating and may manifest as either crippling sadness or uncontrollable rage, and it can take a lasting toll on an individual's self-esteem. There are two main strategies that people with ADHD use when they're living with RSD, and they can either become people pleasers and they're trying to, or they stop trying altogether. If there's the slightest possibility that a person might fail at something or fall short in front of anyone else, it becomes just too painful or too risky to make the effort because there's that risk that you could fail and fall short. And other people, they use the pain of RSD to find adaptations to overachieve, and they constantly work to be the best at what they do and strive for that elusive but idealized sense of perfection. I know, and I'm just speaking from experience, and my husband, this was one of the hardest things for him to communicate what
Mhm.
he was feeling. And a lot of people feel a lot of shame with the RSD, but it's hard for them to explain to other people,
Mhm.
what that feeling is actually like. And well, RSD is not an official symptom of ADHD. emotional deregulation is common. And how often do you see emotional deregulation in your patients?
So in children, would say about up to half of the children that I see have some difficulty with that. Just the emotional dysregulation that could be meltdowns or other things that other people may see as like bad behavior or disciplinary issue, but when in fact it's they're having trouble regulating their emotions. In adults, I would say, a third to half of the patients do experience that. And it's probably more than that, but like you referred to earlier, sometimes it's hard for people to even know what to say to communicate something, or maybe they experience it, but they're afraid to say anything about it, that as well. So it probably occurs more often than that, but in terms of how much of that do we see in clinic, about half of children and a third to half of adults.
It's good to know. Like I said, when my husband started reading and doing research and learning more and more about it, he was like, oh my God, this is me. I've lived with this my whole life. Um,
Mhm.
are there any effective treatments for RSD that can help a person regain a healthy sense of self?
Mhm. So there are several medications that can be effective in treating RSD, and also psychotherapy or counseling, behavioral therapy. So psychotherapy can be helpful, as well as stress management as well. So looking at all those different things. Some treatments are more effective for others than some of the other ones, but there are medications that can help, as well as the psychotherapy components.
Awesome. So not all symptoms of ADHD are negative. We've talked a lot about the challenges and the difficulties that ADHD present, but some symptoms, if they're channeled in the right direction, can be very positive and even become a person's superpowers. A superpower is a natural ingrained gift. It's something that's so powerful that you can't not express it. I mean, it's just a part of who you are. And sometimes you may not even recognize it as a superpower. In some settings, it can help you to shine, and in others, it can transform into your kryptonite because of the environment. It may not be appropriate. Sometimes we have limited control over our environment or our setting, but the value of identifying what your superpowers are is the perspective that it gives you, especially in a school setting. A friendly or athletic student will begin to understand that their behavior is not inherently bad, as they may have been told. It's just not right for certain environments. If we can identify our superpowers, we won't be defined by our struggles. It helps our anxiety to fade, and we can look for ways to let our superpower shine in school or in work, through leadership opportunities, special projects or elective classes, extracurricular activities or volunteer work. Um, ADHD can give a person unique traits and abilities that make them more creative, spontaneous, caring, energetic. Embracing their superpowers can help a person learn to be proud of their ADHD. I don't know if any of you follow the Holderness family. They're popular on social media, but the father of the Holderness family has ADHD, and he is proud of all of the gifts that it has given him. Um, all the out-of-box thinking, humor, drive, and the passion that it brings. ADHD is often that secret sauce that many successful artists, musicians, athletes, entrepreneurs, and other creators that makes them who they are. For example, being an engaging conversationalist or having the ability to be hyper focused on a certain passion, as well as being a fluid multitasker. Having an innate understanding of intuitive technologies, ingenuity, generosity with time and money and resources. How can a parent or a partner help an individual with ADHD to identify and maximize their superpowers?
So I think supporting the person, of course, everyone's superpower is a little different, but supporting and helping to identify what that strength is and how can we channel that into something positive. So, so support, that's I think that's the biggest thing. And then sometimes people, so it's a process in kind of identifying, what is my superpower. So going through that journey in providing that support, in trying to identify that, and then how do we channel that into something positive. That's definitely most important.
Awesome. Are there any career paths that stand out to you that cater to some of these ADHD superpowers?
Well, that answer can vary a little bit based on a person's passion. So, in general, though, creative or engaging and interactive professions can work out really well. These can be things like teachers, nurses, people that work in sales, um, software engineers, it really depends on, and what's most important is what are you passionate about, and what profession will allow you the ability to carry out that passion every day.
Awesome. I think following our passion is important for all of us, but even
Mhm.
especially for an individual living with ADHD.
Yeah.
An untreated ADHD can make an individual feel like a failure. It can cause depression, anxiety, low self-esteem, like we talked about. But with early intervention and the proper treatment and support, individuals living with ADHD can lead incredibly successful lives and follow their passions and use their superpowers. Many of the people on this slide, famous people who you can recognize just by their face, that they also are living with ADHD, but look what they've turned it into. Just some awesome qualities of ADHD I wanted to share with you. And I loved this quote. I found it. It says, no matter how your brain works, celebrate you. So while there's no cure per se for ADHD, medication and other treatments are tools to manage the disorder and help a person conquer their challenges and capitalize on those superpowers. Treatment and other self-help strategies can restore a person's self-confidence and self-worth and help them to achieve their goals and successes. Most people, when they think of treatment, think only of psychiatrists, psychologists, counselors, or therapists, though. And they may be surprised to learn that yourself, as a family nurse practitioner, and a physician or family medical doctor are the primary partners at your practice. Can you tell us how your approach to treatment may be different than some other types of mental health professionals may provide?
Well, our approach is that we make treatment recommendations based on evidence-based guidelines, or those are also referred to as best practice. And so, what that means is these are recommendations that are made by way of research, of a particular area, showing what is the best treatment and to give us the best outcomes. So, just as there is guidelines for treating, say, hypertension or diabetes, there are also these guidelines for ADHD. So, my background is in family medicine as a primary care provider. And so in that role, you're going to see more the ADHD than anyone, because you're the first stop for many people who notice, hey, I've got these symptoms, or I need to talk about a problem. So when I worked in primary care, I noticed, there's a lot of people that were being treated for maybe anxiety, depression, mood disorders, but they weren't getting better, no matter whatever the treatment was that they were doing. And so that's when I really become interested in treating ADHD. So it's sort of kind of diving into more of, there may be more to it than just whatever we see on the top. So really all that to say that it isn't necessary to be diagnosed with ADHD by a psychiatrist, or psychologists also can diagnose ADHD. Psychologists just do not treat with medication management, but many psychologists can make a diagnosis or counsel a person. But it's not necessary for a psychiatrist or a mental health nurse practitioner to be the ones that diagnose. So the important thing is that no matter who does the diagnosing, that it's accurately diagnosed and that it's treated optimally.
Awesome. So what are the most common types of treatment? I know you said that medication was the gold standard. Are there any other common treatments or therapies for ADHD that people should know about?
Right. So for those that are age 6 and above, stimulant medication is the kind of the gold standard or the first recommended treatment. In children, behavioral modifications at home and at school, those are also important as well. For adults, again, stimulant medication is the first recommended choice. Psychotherapy for adults can also be helpful. And then whether it's a child or an adult, there's also other treatments in terms of prescription medication. There are non-stimulant options.
Mhm.
But really looking at the whole big picture as well of, how can we fine tune our diet? How can we make sure we're getting enough physical activity? All of those things as well play an important role into our overall mental health and well-being as well.
So I know in the past, a lot of people, it was a common misconception that, oh, kids have ADHD because they have too much sugar
Yeah.
and they're eating too much sugar. So what are some of those diet recommendations and nutrition recommendations that you recommend to your patients?
Yeah, so actually it's been interesting. They've studied elimination diets in ADHD, but none have really been proven to make a big impact on overall ADHD symptoms unless a person had an intolerance or an allergy to whatever was being eliminated in the diet. With that being said, though, the big things we can do with diets, well, children and adults, is make sure we're getting enough protein because a lot of times we're falling short on that. And protein is super important to help stabilize our glucose or our blood sugar levels. And then when we have more stable blood sugar, we are able to focus and pay attention better. So protein is huge. Also, kind of your overall big picture of your diet and having more of a mix of complex carbs, fats, and proteins instead of these quick snack foods that really are bad carbs that turn into sugar. So looking at that overall can those dietary changes as well as more fiber in our diet with fruits and vegetables can really make a big impact.
Awesome. That's good to know. So as you said, medication is the gold standard in treatment for ADHD, but I think that there's still a lot of stigma around medications for mental health disorders, even as the stigma for some other forms of treatment may have lessened in recent years. I think when we teach mental health first aid, I compare it to, an individual who is diabetic or has high blood pressure. And while they could treat those diseases with, lifestyle modifications through nutrition or physical activity, we would not shun a person for also taking their high blood pressure medicine or taking their insulin, in addition to the lifestyle changes. But how do you go about trying to overcome that stigma for somebody with the medication?
It's really hard. It is, unfortunately, you're right. There still is a stigma associated with treating ADHD or even having ADHD, right? So, but really, that's because there is still a lot of ignorance regarding ADHD and what it is and what it means. But what's important to know is that if you're someone that has ADHD, knowing that you're worth it and that there isn't shame in wanting to have a greater quality of life. So, so you're right about the stigma, but also the those that kind of have questions or it's not a real thing or things like that. It's also an opportunity for us to educate those people and point them in the right direction because education is key to bringing down or changing minds and eliminating stigmas that are associated with ADHD.
Yeah, definitely. And that's one of the reasons why we wanted to do this segment today. And for those of you who are coming on later or people who may have missed it, we're going to have this recording available on YouTube and on our Facebook channel so that you can share this with people as well. I know some people avoid taking medications because they're afraid that it will diminish their creative superpowers. What would you say to someone with that concern?
Well, being creative is part of who you are. So being able to focus more, concentrate better, fidget less, or not get distracted as easily really isn't going to interfere with one's ability to be creative. So no, I don't often come across that that issue, I feel like that overall, that people just feel like they're more productive in general. So that can, also play a part in that creativity process. But no, being creative is usually kind of ingrained in part of who we are. So treating ADHD really isn't going to interfere with that.
That was good to know. How can medications enhance and support other treatments or therapies, such as cognitive behavioral therapy? Does it make the other treatments more effective to also be on the medication?
Right. So, choosing medication treatment for ADHD can be very important when we're talking about those other types of treatments like behavioral therapy. I mean, if you think about it, if you're in a therapy session with your therapist, you know, you're going to be able to absorb the information much better, and utilize what you learned during the sessions afterwards. If your attention and your focus, and you're not getting distracted. So it does make a huge difference in how effective those can be in the long run.
Awesome. And we had a question come up, and a person just asked if you could reiterate what the test was, the computer test was that you used.
Oh, yes, it's called the QB test. It's a capital Q, a little b, as in boy, and then test.
Okay. And Lisa says that my son is 18 and was diagnosed with ADHD in third grade. He currently struggles in school and is resistant to taking his medication, which is currently, I'm not sure how to pronounce it, but it's VYVANSE. Any suggestions on how to convince him that the medication is beneficial to him to take it? And also, how high is the risk that he will turn to illegal drugs in the future as a person with ADHD?
Yeah, those are great questions. So if being, I believe said 18 and resistant to take the medication. So something with treating ADHD though is, my first question would be, how does he feel when he takes the medication? Because a lot of times if we've got a younger person that isn't receptive to taking medication, it could be because there's a certain side effect or a certain way that they feel with the medication that they perceive as negative or maybe a side effect. So that would be important. Looking at that, there's a lot of different treatments for ADHD in terms of medications similar to Vyvanse and others. So some work better on different types of people. So it could just be that he hasn't found the one that makes him feel whatever he would consider normal. So I think that was the first part. And then the second part was about the risk of being addicted in the future. I think that was the second part, right?
Kind of the comorbidity with substance use disorder. What is his risk for that?
Okay. So actually, there's been recent research about, if a person is treated with stimulants, and stimulants are controlled substances. So the reason they are is because of their potential for misuse and abuse. What we're finding, though, and the research demonstrates this, is that people that are treated with stimulant medications that have ADHD versus people that have ADHD and are not treated with stimulant medications, the non-treated group have higher rates of addiction and substance abuse than the treated group. And then if you think about maybe why that would be, a person isn't sort of trying to self-medicate or cope, try other ways to cope with their symptoms if their ADHD is adequately treated. So to answer your question, is the risk is actually lower in those that are treated with stimulant medications.
That is good to know. Like you said, the person's trying to self-medicate or self-regulate often. We talk about that in our mental health first aid class as well. So
Mhm.
that is a good perspective, because it's kind of a little counterintuitive to what the commonly accepted thought might be.
Right.
Thank you for sharing that. We've got another slide to share, but if any other participants have any questions, you could put it in the Q&A or in the chat, and we'll try to get to those as well. So I love this quote I found by an individual with lived experience with ADHD. She said, like a kaleidoscope, an ADHD life can be somewhat chaotic, but it can also have so much beauty as we find our own patterns and unique look on the world. It can be easy to fall into the trap of thinking a loved one with ADHD either has an emotional problem or a behavioral problem or a moral failing because he or she could readily change if they wanted to, or was willfully making bad lifestyle choices. Maybe as a loved one, we sometimes withheld our compassion or empathy because we feel that somehow they deserved what was happening to the individual because they quote unquote chose to behave impulsively, emotionally, or inattentively. Maybe even you criticize your loved one for deciding to be that way, viewing their actions as intentional misbehavior, irresponsibility. But as Maya Angelou said, when we know better, we do better. Like looking through a kaleidoscope, a change of perspective usually brings with it deeper understanding of what may be going wrong with your partner, your friend, your child, or other loved one. And it can lead to greater compassion, empathy, and a greater willingness to assist in managing this chronic condition. Some ways that we can help support a loved one with ADHD. Be an acceptor and a good listener. And our June Mental Health Matters is going to be a whole segment dedicated to non-judgmental listening. Be a support team member. So help with those strategies, those coping strategies, the lists and the tasks, and instead of getting angry that a person doesn't do things, come up with ways to help them to increase their executive functioning. Be an advocate for the individual. Sometimes it may be difficult for them to explain what is going on in their life or what they're experiencing to others, and be an advocate that people will help with that executive functioning and will help with allowing their superpowers to shine, in a school environment, even finding a place, an outlet for that child to express those superpowers. And to become a benefactor. So this is not something that we all may be able to do, and definitely not. But if you have the ability, treatments are expensive. If there's a loved one, maybe a niece or a nephew or an older adult, and that you can provide some financial support to help them with their treatment and medication. We'd like to thank you today, Nurse April, for being with us and to helping us achieve a greater understanding of ADHD. What is one important takeaway that you hope that people got out of our talk today, either for individuals who are watching who may be living with ADHD themselves, or individuals who love those with ADHD? What's that one important takeaway that you really want them to carry with them this weekend?
There's so many. That's a hard question.
Well, take your
But
time.
I would say the biggest one is that ADHD is a real disorder that impacts a person's brain's growth, development, and brain chemistry. And so, if you suspect that you or your child or a loved one may have the symptoms of ADHD, it's always best to have an evaluation, to ask questions, because there is treatment available that works, and it really can improve the quality of someone's life.
Awesome. Thank you so much. And we just want to change the way we think about all mental health conditions in general. And that's really, these are real things. We wouldn't say to somebody, with cancer, you're just making it up. We want to validate their experience, their lived experience, and think about it the same way we would with a mental health condition, but also provide that individual with hope and reassurance that recovery is possible. And it is, possible to, with the proper treatment, to achieve all of your goals and succeed in the things that you are looking to succeed in. We want to share some resources with you. Some of these came from April's website. So if you got here and registered today, you got our invitation email, and you'll see a link to her website in that invitation email. One of the ones I want to point out here, the Attitude Mag is ADD Etude. That is a great website. I've been on that, just a wealth of information and articles and things on there. I see you have one specifically to women, ADD Women site there. We've got some on this one that I love for, it's good for a resource for parents, educators, young adults, even employers who may be dealing with an individual with ADHD. It's called Understood. They have a lot of great resources. And as learning disabilities are common comorbidities, we've also got helping students to learn with learning disabilities, some great information on that. But all of these are good. I invite you to, get out your camera and take a picture of the slide if that's something that you want to visit these resources later. But again, we will also have this posted, this recording as well. But I'll just go back to these. Last but not least, if you stayed with us today, we want to hear from you. So if you could, this Mental Health Matters link, I will put it in the chat and you can click on it. We'd love to know, was this beneficial? Did it speak to you? How was our presentation today? How did you feel the content was? How did April and I do with conveying the information to you? And what topics you may want to see in the future. We love getting together with you first Friday of every month, and we hope that you found this to be a very beneficial way to spend your time on this Good Friday. There is a link in the chat. Oops, I put it to all panelists. Give me 1 second. Let me put it to all people who are watching. And if you could just take a second to take that survey, we'd really appreciate it. You can click on the link. A few more things we want to share with you before we let you go on this Good Friday. First is we do at SC Thrive, we are certified instructors for mental health first aid, which is a program, a curriculum put out by the National Council of Behavioral Health. We offer both adult and youth certification classes. So this is a 3-year nationally recognized certification if you complete the 2-hour pre-work, and then right now we're offering it virtually. So there is a 6-hour online course, but you can also go to scthrive.org and click on organizations mental health for those registrations. We are fortunate to have funding from the Blue Cross Blue Shield Foundation of South Carolina to make these certification classes available at no cost to the participant who is coming through to get their certification. It's a great thing to have on your resume. It's a great tool to add to your toolbox, no matter what your job or role in life is. And we love to train as many people in South Carolina as we can, because that makes South Carolina thrive for everyone involved in our state. The other thing I wanted to share with you is that every year we do at SC Thrive an annual training. And this year it is going to be September 27th and 28th. Hopefully, if COVID stays under control, we will have it live in person in Charleston. And we may also have a virtual option for those who do not yet feel comfortable social distancing at a gathering such as that. But this year, our topic is unraveling the social determinants of health. And such an important topic because it talks about all of those things that we don't think about that contribute to your health. So your education, your income, your socioeconomic status, your location, whether you live in rural or the food that you get, if you have food insecurity, if you're able to provide enough for your family, and all of those things, including mental health, that contribute to your overall health. So we hope that you'll join us in that discussion in September. And there is an early bird registration for the conference. It's a 2-day conference. There's an early bird registration. If you register by April 30th, it is only $100 for that 2-day conference, and lots of great speakers, lots of great tracks. So we do hope that you'll join us for that. Last but not least, we want to thank our sponsors who help us make this possible and who help us at SC Thrive to do the work that we do for our communities all across the state. We hope that you enjoyed your time with us today and will stay connected with us through our website at scthrive.org. You can find out a lot more information about our organization, and follow us on Facebook, where I said this recording will be posted later, Twitter, Instagram, and YouTube as well. So we love to stay connected with you. We thank you for your time today, and we hope you have a great weekend, and if you celebrate, a very happy Easter.